if you validate people's fears, they are better able to decide to overcome those fears. That doesn't guarantee that they will overcome those fears. They might just decide that, they're going to hang on to those fears. But when you tell people their fears are stupid, the likelihood that they will overcome them goes down.
Yeah. Welcome. I'm Chris Martinson, and this is Peak Prosperity. Hello, everyone, and welcome to this Peak Prosperity podcast. I'm your host, Dr. Chris Martinson, and really, we've got a very, very special program for you today. Out of the entire coronavirus series that I've done, I've been doing a lot of science and giving you the data such as it is, and it's changing, and it's been wonderful to be able to assemble the data and present it to you as clearly as I can. But I feel, honestly, that one of the most important episodes I did was talking about something called the adjustment reaction. Now, there's a lot of data that comes with something like a pandemic and infectious diseases, and we're talking about crazy things like R-naughts and transmissibility and how long things live on surfaces and mutations and all of that. But in truth, the most important thing is how you react to it and how you respond. And there's a range of ways that we respond, and there's nothing better or worse, good or bad about this, but we need to be aware of, and I think have an openness towards the idea that each of us is going to emotionally react in a different way to this. And some people are going to react faster and adjust faster, and some slower. Again, nothing right or wrong about any of that, but it's part of the human landscape. And to the extent that our authorities, our national managers, I sometimes call them instead of leaders, depending on the job they're doing, to the extent they are aware or unaware of that same process, really helps shape and define how effective they are going to be at being a manager versus a leader, a true leader of something as contentious and as belief altering as a pandemic. So we're very fortunate today to have one of the world experts on risk communication. In fact, somebody who defined the field of risk communication and the term with us today to help talk us through and walk us through what risk communication looks like, the adjustment reaction, all of that. Today we have with us Dr. Peter Sandman, and he is the author of that piece on adjustment reactions that I liberally pulled from and used and linked back to because it's just such important work. Dr. Sandman here is he's the creator of this phrase, which is risk equals hazard plus outrage. It's a formula for risk communication. He's a preeminent expert, as I mentioned, and consultant on that and crisis communication. We'll learn about the difference between those two pieces there. Author of numerous articles and writings on risk communication. He's got a great website at petersandman.com. And we're really honored to have him here with us today. Academic for much of his career. He started as an environmental communicator around 3 Mile Island. He was a journalist then, and that morphed into figuring out and learning how to become a risk communicator. He's been working on all sides of the issue. He was a consultant for a long time, working with CEOs, companies about risk communication. He's been retired, unretired. Today he's out of retirement again. And he's been heavily involved in infectious diseases, including with the H5N1 outbreak that sort of didn't materialize, but a lot of lessons learned. Dr. Sandman, welcome to the program today.
Thank you.
So let's start here. Let's just give people a quick overview of your background and how it is that you came to be involved in risk communication, because I think that's just a great story. Anything I didn't cover there?
Well, way back when I was a doctoral student, I got interested in environmental communication and did my doctoral dissertation on an aspect of that. And then when I started my academic career, like any other academic, I cannibalized my dissertation and became an expert on environmental communication. And that remained my field, actually, until shortly after 3 Mile Island. I was heavily involved in 3 Mile Island and not managing the accident, but covering the coverage of the accident and covering the flacking, the PR about the accident. And in the aftermath of the accident, I got interested. My focus in environmental communication had been basically, how do you scare people? How do you get people to take environmental risks seriously enough? But 3 Mile Island had other problems. They'd had the problem of how do you keep people from overreacting? How do you reassure people if the risk isn't as serious as they think it is? And then a third paradigm, when the risk is serious and people rightly think it's serious, how do you guide them through it? So I broadened my focus from environmental communication to risk communication and helped invent that field. By the mid 1980s, risk communication was beginning to become a field, and I was beginning to become identified with that.
Peter, I'm wondering if there's a parallel here between our careers in a sense. So I deviated from my life in order to begin articulating to people a view of the world that talked about the risks and the various predicaments we face and all of that. So when I started, I thought I was in the business of sharing information with people, and I did that. And over time, it took me a couple of years because I'm a quick learner eventually. I figured out that I wasn't in the business of sharing information. I was in the business of challenging belief systems. Totally different place to be in. It's an emotional territory, not a logical territory. It's not about the data, but it's about how the data is presented. Is that something you discovered as well, that it was your field is maybe less about the structure of the data and more about the delivery of the data?
I mean, that's fundamental, not just to risk communication, Chris, but to essentially all communication. I mean, many people have in the back of their minds a sort of a rational model of how communication works, that there's information, and the information influences your attitudes, and the attitudes influence your behavior. And there's no question that sometimes happens. But more often than not, it happens in the other direction. There's behavior, and you build your attitudes around your behaviors to make sense of your behaviors. And then you go out information seeking, looking for information that supports the attitude behavior complex that you have evolved. And then you become very resistant to information that might tell you you're wrong. It might tell you your attitudes are wrong, but even worse, might tell you your behavior is wrong. So we are all, if you will, still thinkers when we get information that conflicts with what we already know, with what we're already doing, what we already believe. We'll say, well, that's fine, but I still think, and we go back to our prior attitudes, our prior information set, and above all, our prior behavior. That's key to risk communication, but it's not a creation of risk communication. It's key to communication itself.
Right. So with that as a cornerstone of that, and by the way, the people listening to this are all familiar with the backfire effect, and we've studied that. And I told people that in my own communication arc, I had to take a big tour through behavioral economics, standard psychology, understanding how we're wired, ultimately understanding the cortex versus the limbic system. There was this whole field of study I never thought I was going to get involved in, because I was just trying to tell people about how oil fields deplete and things like that, right? So it was a lot of fun. But now we're in a really serious situation here, and COVID comes along. And so if you could, Peter, in your own words, what happens when something like COVID comes along? You got a culture, it's operating the way it operates, it's got a whole sort of a trajectory to it, and COVID comes along and crashes into that. What is that process really about for people in terms of data versus emotions? What's happening?
Let me approach that through the back door, if I can, Chris, and talk a little bit about the basics of risk communication and where a crisis like COVID fits in. And the core understanding of risk communication is the extremely low correlation between whether a risk is dangerous or how dangerous it is and how upsetting it is. And for those of your listeners who like numbers, that correlation is about 0.2. You can square a correlation to get the percentage of variance accounted for, a glorious 4% of the variance. Or here it is without numbers. The risks that upset people and the risks that kill people or hurt people are completely different. Now, I'm not saying if the risk is upsetting, that in itself proves it's safe. That would be a negative correlation. And what we've got is a correlation essentially are very close to zero. So all four corners of the matrix are filled. So for convenience, in the 1980s, I renamed how dangerous it is hazard, and how upsetting it is outrage. So what I'm saying is the correlation between hazard and outrage is this very low 0.2 correlation. So that gives you, if you look at the four corners of that matrix, if the situation is high hazard, low outrage, it's dangerous but not upsetting. Then the risk communication task is what I call precaution advocacy. Essentially, watch out! This could kill you. Do something. So precaution advocacy is probably the oldest kind of risk communication. It's the first kind of risk communication we do with our children. Telling them to watch out, take care, don't do dangerous things. In the opposite corner, we have the risks that are high outrage, low hazard. They're not terribly dangerous, but they're very upsetting. And there the paradigm is calm down. The message isn't calm down, because calm down is not an effective message. No, and especially if it's calm down, you hysterical idiot. The calm down doesn't calm people down. But the paradigm is calm down. Then you have the high.
Peter, what are some examples in there?
I'm sorry?
What are some examples over there in the low risk, high outrage category?
In the low hazard.
Low hazard.
Category,
sorry. Yep.
You have the typical Superfund site, for example. It's a hazardous waste site. It's scary. Some hazardous waste sites are very dangerous, but if it's properly managed site, it's probably not very dangerous. Living a couple of miles away from a hazardous waste site is not likely to be a serious hazard, but it's likely to be quite a serious outrage. Ebola in the US was high outrage, low hazard. Ebola in West Africa, and then later on in the Congo, was high hazard and high outrage. But in the US, where it was never likely to be a severe outbreak, it was low hazard, but for many people, it was still high outrage.
Okay, thanks for that. Yeah.
So the third corner is crisis communication, high hazard and high outrage. And the fourth corner is not interesting, right? Low hazard, low outrage. There's no risk communication to be done. I mean, what would you do? Congratulations on your apathy. You're absolutely right. This really is not dangerous. So I never found a way to earn a living in that corner. But I did earn my living in the other three corners, doing precaution advocacy when people were insufficiently upset, and outrage management when people are excessively upset, and crisis communication when people are rightly upset. Those are the three paradigms of risk communication. Now, when you get a crisis, in the early stages of the crisis, the experts are going to notice that it's serious. The public is not yet going to notice that it's serious. And your paradigm is precaution advocacy. You're trying to warn people. We obviously did a horrible job of COVID-19 precaution advocacy. The experts who were trying to warn people failed. Part of the problem is a lot of experts were afraid that if they warned people, because you didn't know whether COVID-19 was going to be severe or not. Long after you knew it was going to be a pandemic, you didn't know if it was going to be a very bad pandemic. We had, as some people will remember, the H1N1 pandemic. It was a genuine pandemic, and it was milder than seasonal flu. So it was a pandemic that saved lives, which is kind of a paradox. So the experts didn't know if it was going to be severe. So they were a little reluctant to warn people. I mean, the logical thing to say to people about something that might be really awful but might fizzle is to tell them it might be really awful but might fizzle, and get them to take appropriate precautions. And if it fizzles, you're glad. In the same way that, you buy insurance not in the hope that your house will burn down, but in case it does. But I think the experts were afraid to warn, partly because they had warned about H5N1 and it didn't happen, and they'd warned about H1N1 and it happened, but it was mild. And they were feeling like, we don't want to be accused of alarmism again. So they did a horrible job of precaution advocacy. They barely tried. Mm-hmm. This is where the adjustment reaction begins to come in, because in the early phases of a crisis, people start to notice that this might get bad. And while lots of people are still complacent, lots of people are underreacting, a lot of the experts are underreacting and they're over-reassuring, and government officials are saying, don't worry about it, it's no big deal. We'll worry for you. We're watching it just in case it gets serious, but you don't have to worry. But some people began to go through an adjustment reaction. And that is, they overreacted, or they reacted prematurely. And you had the famous toilet paper, the run-on toilet papers, and other kinds of signs of adjustment reaction. Adjustment reaction is not only normal, it's healthy. It prepares you for a crisis. And, the people who had adjustment reactions to COVID-19, were the ones who later on got to say to the majority that was complacent, I told you so, because they turned out right.
Yeah, so this adjustment reaction is something that an individual would experience, I think, not just for COVID, but for any big sort of, what's the right term for this? It's not even necessarily a risk, but something that's really going to impinge and change the direction of things. But especially for something that is a risk, and it could be a risk to health, life, limb, financial risk. It could be all sorts of things, right? It doesn't have to be, this is life or death, right?
It does not have to be life or death, doesn't have to be a health or safety risk, but it's something new in your environment that looks like it might represent a major negative change. And you personalize it. It may be already happening someplace else. It's already happening in Wuhan. It's already happening in Milan, but it's not yet happening here in Arizona. But you personalize it. You think it's happening. You take precautions prematurely. You become hyper vigilant, and then if the crisis materializes, you're better prepared. And if the crisis fizzles, you come out of your adjustment reaction and you shrug it off and you say, well, I guess I have a year's supply of toilet paper.
Yeah, well, and so I want to step through these. So you wrote here at your site on the adjustment reaction, when someone first learns about a new and potentially serious risk, the natural health, the useful reaction is an overreaction, and it begins with this: you pause. In terms of COVID-19, what does the pause mean? What's an example of it?
You pause your other activities. I mean, there is a sort of a law of conservation of outrage. You can only be upset about a certain number of things. You only have as much upsetness in your system as you have. So, if you're going to start taking COVID-19 seriously, you have to pause some other things. You have to worry less about other things to make room in your worry budget to worry more about COVID-19. So that's what that pause is all about.
Okay, the law of conservation of outrage. So the pause. So there's an observational period, a stepping back, a conservation of resources, as it were. In this case, emotional or mental resources. And then you say here, next step, maybe you become hyper vigilant. What does that look like?
Yeah, well, you want to know if this is as bad as it looks like it might be. So you pay more attention to news than you did. Your Google searching pattern changes. Depending on what the crisis is, the signals might be different. So for COVID-19 in the early days, it had something associated with China. So you might have avoided Chinese restaurants. You might have avoided going to Chinatown. You certainly would look harder. You would worry more about someone sneezing in your vicinity because you picked up the idea that COVID-19 has something to do with sneezing, even though there isn't any COVID-19 in your town yet. Sneezing becomes something that you notice more than you would have noticed a few weeks ago.
Great. Thanks for those examples. And then in personalizing the risk, you mentioned this before. What does that mean to personalize the risk in this case?
Well, you are likely to imagine that it's hitting you. For example, if you sneeze, normally I sneeze, and what do? I blow my nose and then forget about it. But if I sneeze when I've been reading about COVID-19, then I'm worried that it might be coming to the U.S. And as you know, obviously that turned out to be a perfectly reasonable thing to worry about. But early on, if I sneezed, that might scare me in a way that represents a personalization of the risk.
Great. And I think you take extra precautions is the last step. I think that makes a lot of sense here. And we're seeing a bifurcation of that in the United States right now, where a lot of people are wearing masks, and then other people are saying, no, I'm not wearing masks. And from where I stand, the wearing of masks is one of the most logical, easy things to understand, because it's not so much about protecting me from you as protecting you from me and all of that. And it's part of being part of a tribe. So a lot of people took these extra precautions. I know people who haven't even stepped out of their home basically in a couple of months now. Other people aren't taking precautions at all. They want to get on a cruise line. They want to go to the beach. They don't want to wear masks, all of that. Would you suggest then that this simply reflects the degree to which people are in different places on the adjustment reaction?
Well, no, we're past the adjustment reaction at this point.
Good.
The adjustment reaction is an early crisis, pre-crisis and early crisis phenomenon.
Yep.
What we've got now, well, it's complicated. I mean, there are probably still some people who are complacent about COVID-19, especially young people who have learned that they are not all that vulnerable, and maybe they lack empathy for their elders. Maybe they don't have much contact with their elders. And there is COVID-19 complacency. There is COVID-19 denial, which looks like complacency, but is actually its opposite. That is, if you're really freaking out and you're at risk of panicking, you trip an emotional circuit breaker and you go into denial instead. Denial is a zebra. Complacency is a horse. I mean, in general, when people act like they don't care, they don't care. But there are times, and COVID-19 is likely to be one of them, when some people care so much they can't bear it. They're so upset they can't bear it. So there is COVID-19 denial. Denial is why panic is rare. It's very hard to find any examples of COVID-19 panic, precisely because denial is available. If you're at risk of panicking, you can flip that circuit breaker and go into denial instead. Yep. And then there's perfectly normal, rational, desirable COVID-19 fear, where you're appropriately worried. And if you're my age, you're more worried than if you're my grandchildren's age. And you are taking rational precautions, but you're not necessarily taking them entirely rationally. You're upset, so you're in crisis. You're in a high hazard, high outrage environment where fear is the appropriate response.
All right, and so to back it out a tiny bit, and I do want to get through the steps first. to reiterate this, because point, I think this is one of the most important points we can make is this is completely normal. It's completely natural. It not only it should be expected, but it should be encouraged that people go through an adjustment reaction. Is that correct?
Yes, early on in a crisis or in the pre-crisis stage, officials tend to imagine that the public is panicking. They tend to interpret the adjustment reaction as a panic. And they go into what I have sometimes called panic. They feel panicky about their misperception that the public is panicking. And so they do a variety of things that are harmful to the adjustment reaction. They over-reassure. They appear overconfident. They say, "I know what I'm doing. I'm sure I'm an expert here." They express contempt for the adjustment reaction. You're being hysterical. You're being a fool, and all of those things are undesirable. What you want to do is guide people through the adjustment reaction. Help them take wise precautions rather than unwise precautions. Mm-hmm. Help them take precautions that are forward-looking. That is, if the adjustment reaction is premature, which it usually is, then you want them to take precautions that will stand them in good stead when the crisis reaches them, rather than precautions that are excessive now. And let me sort of stop for a minute. If I had to say one thing the United States did wrong about COVID-19, and it's hard to pick one thing because we did so many things wrong, but if I had to pick one, it was locking down most of the country prematurely. Mm-hmm. It was an unwise adjustment reaction. Now when New York City locked down, that was probably sensible. New York City should have taken precautions earlier. The virus got out of control in New York City. The hospitals were at great risk of being overwhelmed, and indeed some of the hospitals became overwhelmed, and a lockdown made sense. You threw everything you could at the virus. But most of the country didn't look like New York City at all. And we'll take Arizona, because Arizona is starting to look like New York City now, as you and I talk. And I heard someone on television yesterday say, Arizona came out of lockdown too soon. And I would say Arizona went into lockdown too soon. It went into lockdown when it had very little virus and very little transmission. And what it should have been doing is taking much more modest precautions that did much less harm to its economy, and monitor the situation. And, it might or might not have needed to go into lockdown about now. But it exhausted its capacity for lockdown way before anything like that was needed.
Yeah, so you have a lockdown budget. There's only so long you can keep people in lockdown, right? And an economy and all of that. And so you've got to time that very carefully. But to me, the authorities needed to have clear, consistent communication all the way through. They should have been saying the same things, and it should have been all 50 states having sort of the same message, that there should have been a national coordinated, here's how we're going to respond to this thing. And in fact, what's frustrating to me, Peter? I can read documents that talk about how to do this that were written 20 years ago that look perfectly valid. You dust them off. The WHO has a perfectly beautiful pandemic document. Looks like it was created about 20 years ago.
I helped write some of those documents. So,
very well done then. They're great.
I share your sense of frustration about that. But I have to, what you said is true, but it might be misleading. Yes, there should be national messaging, but there shouldn't be a national response, because pandemics have, sweep through places. The United States is a big place. And, if you ask the question, what's the average temperature in the United States right now, you would very quickly, decide, because it's cold in some places. Did we just lose volume?
We did for just a second, but it's perfectly fine. We can make it.
It came back. All right, I got a message from my thing. All right, I'll back up. If you ask the question, what's the national temperature in the United States right now? You would very quickly decide that's a dumb question. It's cold in some places. It's hot in other places. Temperature is not a national phenomenon. All the pandemic plans I ever worked on talked about targeted, layered, local responses. So yes, there should have been national messaging, but the national messaging should have emphasized local responses. And it was a horrible mistake for most of the country to respond the same way New York City responded.
I'm with you on that. I hope I wasn't implying or misleading that we needed a national response, but I wanted national messaging. And just one example, again, face masks. Very simple logic. And we had all these national U-turns on the whole thing, with the Surgeon General coming out and saying, oh gosh, people shouldn't wear masks, and then later saying we should wear masks. In one embarrassing moment, he even took a T-shirt and folded it up and showed how to fashion a face mask out of a T-shirt months after private citizens had figured out how to fold blue shop towels into like sewn patterns. And like we had a whole like cottage industry of people making things far more elegant than the Surgeon General, who's got a few resources at his disposal to figure that out. I thought that was an embarrassing moment nationally, when you can't even organize around something as simple as face masks. But that message should have been clear and consistent. And then later we had Fauci coming out and saying what I knew all along, and everybody I think sort of knew, which was, actually, we were kind of fibbing to the public because we wanted the masks for the healthcare workers, but we didn't want to just say that outright. So that was an example to me of them mismessaging, burning capital on that, and then having to undo that. And now they can't undo that. And that's why we see this face mask problem that we have right now, because the messaging was just a train wreck from beginning to end.
Yeah, I mean, messaging about masks. I mean, they weren't mostly mistaken. They were mostly dishonest. Mm-hmm. They knew that masks were helpful. They knew that masks were helpful not primarily as personal protective equipment, not primarily to protect you from incoming virus, but as source control to protect others from outgoing virus. So that they knew all of that, and they thought, they despaired of convincing people of that. They were afraid that if they said, yeah, masks are useful, they're useful mostly to protect other people from you, and we'd be really grateful if you'd use cloth masks and informal masks and non-medical masks. They thought that was too, save the good masks, the best masks, particularly the N95 masks for healthcare workers. They thought that was too complicated a message. So they did what they always do, which is, faced with a choice between a truth that they thought was bad for public health or a lie that they thought was good for public health, they prioritized public health over integrity. And they always do. I mean, the public health people, they try to tell the truth when they can, but they put a much higher priority on saving your life than on telling you the truth. So when they think those point in opposite directions, they lie to you. And then they wonder why you don't trust them.
Yeah, very well said. So before we move on to where we go from here with this whole story, I just want to wrap up the idea of an adjustment reaction. Probably one of the most, of all the emails I got and all the comments that were listed under the YouTube video around the adjustment reaction, this was the one that evoked the most of people feeling relief, profound relief, because these people typically were following my stuff, go through a much more rapid automatic adjustment reaction than the people around them. And this creates a lot of tension in their lives because they feel like something's wrong with them, or is there something wrong with all these other people? And to them, it's all clear and they've already gone through the little arc and the other people are somewhere way back on the arc. And so not understanding this automatic natural response and that we all go through it at different paces can be very frustrating. But boy, the relief that comes when you see it that way and you go, oh, I just went through mine faster and now I have the opportunity, if not the responsibility, to help others navigate their own. So it's an opportunity rather than a deficit in this case. I just love your reaction to that.
Yeah, I got the same experience you had when you did your adjustment reaction show. I mean, I had a lot of emails from people saying, "Thank you for explaining the adjustment reaction." Either I felt like I was being an idiot, and this helped me understand what I was doing, or my family thought so, my friends thought so, my colleagues thought so, and this was something I could show them to explain that this is reasonable. I think it's important to understand that the adjustment reaction is a normal, healthy reaction, even if the crisis fizzles. I mean, it's not just that you're guessing right. If you have an adjustment reaction and you become hypervigilant and you take precautions, you are in a better position to notice what happens. So if the crisis gets worse, you're in a better position to notice it and you're ready to respond. If the crisis fizzles, you're in a better position to notice that and stand down. So it's not only useful when you turn out right, it is also useful when you turn out wrong.
Yeah, and wrong is something I don't like to be as binary as that, because I think what people are doing are playing the probability. So, one of the things that's often trotted out is, oh, all those people who put together bomb shelters around the Cuban Missile Crisis, ha ha ha, look at all that wasted effort. But in fact, the probabilities were heavily weighted towards that being a very legit, very serious crisis. And in fact, 20 years later, we got the memoirs from JFK's chief of staff saying, we were this close, right?
Very close. Yeah.
Very close. So in fact, those people were behaving, I think, very prudently. The people who were reacting, they were reading the tea leaves correctly. But it's not only okay, it's wonderful that it didn't go that way. But it doesn't mean that it was wrong or that their reactions were out of alignment with the actual risk that was contained in that period of time, the hazard that was there, right?
Yeah, and I mean, any well-run organization and any well-run individual is looking at risk in terms of magnitude and probability. Mm-hmm. And if the magnitude is super high, and if the probability is also super low, you shrug it off, right? I mean, yes, an asteroid crash could kill me tonight, but I'm not going to take asteroid precautions. But if the magnitude is super high and the probability starts rising from very low to low, and now it's looking like it's moderate, by the time the probability is moderate and the magnitude is super high, if you have a brain, you're taking precautions. And you're not taking those precautions because you think the probability is extremely high. You're taking those precautions because moderate probability is high enough when the magnitude is very high.
Great. So here we are. It's June 29th. We are more than 6 months into this. And earlier, I think you said that COVID, we're not done with it. It's not done with us. Where do you stand on COVID at this point? Does it fizzle from here? Where are we at? Is this something we're just going to have to learn to live with and readjust our sense of risk? Just like my grandparents had to live with the idea that a abscessed tooth could be the end of you. Is that just something we live with now? Or is this, where are we, do you think, in this whole story?
All right, well, look, viruses keep spreading until one of two things happens. Either the virus runs out of susceptible people. Okay, it doesn't have to run out entirely. It runs out enough that it's not finding enough susceptible people. What's called the reproduction number, which I think you've covered in earlier podcasts, is below 1. So somebody who's infected doesn't come into close contact with somebody who's vulnerable, and the virus dies. So that's one way. It runs out of vulnerable people, and that can happen either because we've all caught it already, or because a lot of us have been vaccinated. Mm-hmm. The other way it ends is miracle. It loses strength all by itself, or it just passes. It passes in waves and it leaves, and it doesn't come back for a number of years. And during those years, you haven't got a lot of virus. So until one of those two things happens, until the virus goes away all by itself, or most people are, at least 70% or so are no longer vulnerable, it's gonna keep spreading. In New York City, where I live, they think about 20 or 25% of the population has already been infected. That's not nearly enough to have herd immunity. So, we're very low now, but we're very low out of some combination of it went away, and we took a lot of precautions. As we take fewer precautions, we're going to have more cases because we still have a lot of vulnerable people. So yeah, as Michael Osterholm, who's probably my favorite epidemiologist, says, we're in the second inning of a 9-inning pandemic. And it is possible that we will get a really effective vaccine really quickly, and by the end of the year, most people will have been vaccinated and we'll have herd immunity that way. It's possible. It's likelier than it has ever been, but it's always been extremely unlikely. So now it's not extremely unlikely, but you shouldn't be betting on it. Yep. So maybe we're going to get a really effective vaccine. If we don't get a really effective vaccine, or until we get a really effective vaccine, we're going to live with this thing. And what we need is a balance where we're taking the virus seriously but not obsessing over it. And we're resurrecting as much of our economy and as much of our way of life as we can. And the metaphor that's often used is dancing. We're dancing with the virus. We're keeping the number of cases low enough that our hospitals aren't overwhelmed. We're taking special precautions with people who are especially vulnerable, the elderly, the people with comorbidities of various sorts. We're doing everything we can to protect them. And little by little, more and more people are getting infected. We're hoping they stay immune after getting better for at least a few years. And we're learning to live with it. That's the best case scenario is we get a wonderful vaccine. The second best case scenario is we learn to live with it. So far we're doing a crappy job of learning to live with it. Mm-hmm. But it's only the second inning. We may still learn to live with it. The United States is way behind a lot of other countries. Europe seems to be doing a better job than we are. Most of Asia seems to be doing a better job than we are. But they're not immune yet either. They've got plenty of vulnerable people, so they're in the second inning too. And we're going to have to wait and see how the game ends.
Yeah, and on that point, I've always said there's obviously a balance here, and you got to keep your economy functioning, because if that crashes, you're going to have probably a worse public health outcome than COVID could even think of ever delivering, right? But at the same time, you've still got a very serious thing going on with COVID, and I'm in the camp of saying buy as much time as you can while not crashing your economy. You got to balance those things out. And so I think China's done a really very good job. And of course, they're authoritarian, and we can have lots of critiques over, how they might have done it from a civil rights, human rights standpoint, and all of that. But I featured this one video from this gentleman who's a Brit, and he's operating a factory in China. In China, this was a month ago, and they had these 6-point plan for every factory. You have to follow these things, and if you all do these, that's that, and included everybody's wearing a mask, obviously, and they're disinfecting the facility twice a day, and on, right? But they got on with it. They developed a cogent response. They said, here's what we're going to do. If anybody ever shows up at your factory, first thing to do is scan them on the way in the forehead. And anybody has a fever, boom, they go into a room, they're evaluated, they're assessed, and something happens, right? So I saw that. And then you see the way New Zealand has their response, and Taiwan has theirs, and Hong Kong has theirs. It turns out there's a lot of ways you can manage this. We're not quite there yet in this country. What would be required to get us there, do you think, if it's possible?
Bearing in mind that, you're talking to a communication expert about epidemiology. So I mean, I'm going to give you secondhand information because this is not my field. But they kind of know what's required, and they even have sort of figured out that some things that democracies are bad at, you don't get to put on the list because you're not going to be able to do it well, and you have to find a democratic way of dancing with the virus that may be different from the way China dances with the virus.
Mm-hmm.
But the two main things you do is you protect your most vulnerable people and you protect your hospitals. Because if hospitals are overwhelmed, then people are dying that didn't have to die. And they're not just dying of COVID, they're dying of strokes and car crashes because the hospital can't cope with them. So you keep your hospitals from being overwhelmed and you protect your most vulnerable people. And other than those two, you kind of prioritize the economy over preventing infection. The one that's most complicated is identifying infected people and tracing their contacts and quarantining their contacts. That's easier to do in authoritarian countries than it is in democracies, and it's easier to do with something that, with a virus that is symptomatic before it's infectious. The nice thing about SARS, and I worked on SARS, the nice thing about SARS is by the time it was infectious, you were sick as a dog. In nearly all the cases. There were exceptions, but in nearly every case, by the time you were infectious, you were sick as a dog. So the only people, or the vast majority of people who caught SARS were healthcare givers. Either they were family members taking care of a sick person at home, or they were healthcare workers in hospitals. And nobody went to work with SARS. Nobody rode on the subway with SARS. The thing about COVID-19 is you're infectious for several days when you feel fine. And in a large number of cases, you're infectious the entire time you feel fine and you never get sick. You just like Typhoid Mary, only we have millions of Typhoid Marys infecting other people without feeling crappy. So that makes contact tracing harder and less effective. And I think there's a real debate right now among experts. And I don't get to participate in that debate because I'm not an expert in that. I'm a communication guy. But the experts are really divided on whether it's worth even trying to do contact tracing and quarantining of contacts, because of the nature of democracy and the nature of this virus. But the things they know are worth doing are the things you hear all the time, right? You wash your hands a lot. You stay 6 feet away from people as much as you can. You wear a mask, especially when you're not 6 feet away. You keep outdoors more than indoors. And above all, you protect your hospitals and you protect your vulnerable people. And other people get infected. And some of them die, but not many of them. And that's how you dance with the virus.
And on that last point about the statistics of this, and not many people die, my own difficulty. So my PhD is in pathology, so maybe I overfocus on the disease aspect of this, but certainly I have the training there. So for me, the statistics look good until I start reading these things about how people who are even largely asymptomatic had a mild cough, and now they find out that they've got potentially, we don't know, this is the uncertainty, but potentially a lifelong lung impairment because of the fibrotic scarring that happened. And now we're finding out there's neurological deficits in some people, not many, but there it is. And there's this Kawasaki-like disease in children. And we don't know about this particular virus, but it's crazy. Its affinity for the ACE2 receptor, but it also hits the CD147 receptor, which means it's a white blood cell issue. Also seems to go in through neural tissue. It's crazy what we don't know about this. I mean, it's 38 kilobits of information, and it's just astonishing, the complexity that comes out of that. And so for me, managing it from my level of awareness around this is, I just don't know what's going to show up in this thing in a year, or what we're going to find out about it in 5 months from now. And it, like you say, it could magically fizzle, or we might discover this is something that has a second infection that's associated with it, because some people, for whatever reason, don't have a humoral response that's long lasting. We have some cellular way of fighting it off with immunity, but it doesn't last. It comes back. We don't know, right? So it's that uncertainty that keeps me just a little bit paralyzed, Peter, in terms of saying, it comes down to this: I don't want it, right? And that's all I know for sure at this point. At my age and given what I know, I'd rather not get it. Your point is that, if we only have two ways, it runs out of victims, or it miraculously goes away. And the only way it runs out of victims is we get the vaccine, which is a more likely than it was, but still, let's be honest, not terribly likely to come out anytime real soon because of the nature of the complexity of developing vaccines, or it runs out of victims because we've had herd immunity, which means I got it. I don't want it. So that's, I feel like I'm pretty normal in that regard. I think a lot of people are juggling that sort of level of uncertainty and coming to the same conclusion, which to me is automatically economy shattering and changing, is people like me saying, I'm not going to take a flight, I'm not going on a cruise, and I'm not going to Vegas to handle poker chips anytime soon, right? Until that uncertainty lifts. Does that feel like where am I in the adjustment reaction process?
Yeah, well, I mean, the poll data say that you have a lot of company, a very high percentage of the public, and they did a wonderful survey of epidemiologists. A very high percentage of epidemiologists are nowhere near ready to live normal life. Mm-hmm. They're nowhere near ready to live, what we're starting to think of as the new normal. And we can't get to the new normal as long as we're all going to stay holed up in our homes. Mm-hmm. It's paradoxical. There are people who are insistent on getting out. There are people who have no choice but to get out. And then there are people, and they tend to be, wealthier and more professional, and they tend to be white, who have the luxury of I've been in my apartment with very rare ventures outside my apartment for 3.5 months. I got here from overseas in the middle of March. And I've been, since the middle of March, I've been out and about twice, and up to the roof a few times. That's it. But I have a good apartment, and I have a beautiful view, and I have a sweetheart who I adore, and I have a good internet, and I couldn't have done it without all of those. And I don't have to earn a living because I did that already. So I'm living on retirement. So there are people who have to go out. There are people who want to go out. And then there are a whole lot of people like you and me who don't have to and don't want to. And as long as that continues to be the case, I think the economy is going to have an enormously difficult time recovering, because, we've got too much of the money, and we're not going out and spending it. Mm-hmm. I don't have a solution to that, but I know one piece of the solution to that is to be candid about the uncertainty. If you tell me I'm an idiot not to go out, I dig in my heels and I'm less likely to go out. Mm-hmm. You tell me, of course I'm afraid to go out. Of course I'm worried about what they don't know about this virus yet. Of course I'm wondering, even if they get a vaccine, even if they give me the vaccine, even if they tell me I've got, good antibodies, and my T cells are strong and I'm good to go, I'm still not sure I want to sit in a restaurant. I'm still not sure I want to go to as you say, to the casino and handle poker chips. If you validate people's fears, they are better able to decide to overcome those fears. That doesn't guarantee that they will overcome those fears. They might just decide that, they're going to hang on to those fears. But when you tell people their fears are stupid, the likelihood that they will overcome them goes down. So insofar as we want the economy to recover, we have to validate the fears of people who are reluctant to go back into the economy. And for heaven's sake, we have to validate the fearlessness of those who are willing to go back into the economy. And it seems to me, one of the stupidest things we do is tell young, healthy people, fine, tell them to wear a mask when they're near people like me. By all means, tell them, to spend a lot of time outdoors, not indoors. Tell them to keep 6 feet distance. Tell them to wash their hands, but don't tell them to stay indoors. They're the ones who are willing to go out and spend money and earn money, and they're the ones who can most safely go out and spend money and earn money. And we ought to be. I don't want to make them heroes, but we ought to certainly encourage them to do what they want to do.
Oh, absolutely. For me, I think this is realistic. I have the sense that if I got on a 747 and there were 230 other passengers, I know that at least a couple of them would not be wearing masks or have them pulled down under their nose, or feeling like they should be free to cough or sneeze into the open air. And I'm out of there. Like, that's it. Until we have we talk about 8 forms of capital people can build, and one you can't actually build, you can just live in, is cultural capital. It's hard. Culture is a very slow changing thing. So I feel great about where I live in Western Massachusetts right now. When I go out, 99% people wearing masks. Usually it's just some old guy who refuses, but otherwise I feel the coverage is sufficient that I feel safe. But there are other places where that would be almost inverted, and I wouldn't feel very good in those particular places. And that's the local culture. Right. And there's not much I could do if I lived in a place where 99% of the people decided they didn't want to wear masks, except to choose not to engage with them. So to me, that's the main inhibitor in this whole thing is getting people into those normal things you said, which is reasonable distancing, reasonable amount of hand washing, and also public sanitation of public surfaces, doorknobs, railings, escalator, banisters, things like that, and mask wearing. If we had those things in place, I feel like we can get back to this much more rapidly relative, because I am going to be that person who does have the luxury of choosing to go out or not to go out. And if I go out and I see that it's not safe, because I still don't want this thing, I'm pretty sure I still would like to avoid it if possible. Who knows? Maybe I already got exposed and I was asymptomatic all the way through. Who knows, right? But to the extent that I believe I haven't gotten it yet, I would very much like to maintain that track record. And to me, so that's why talking with you and this subject, communication is the most important thing that we can get right in this story. And unfortunately, I would give my country, the United States, low marks on that consistent communication about the uncertainties, about the risks, and about the things we should be doing, which were just those simple things: the distancing, the sanitation, and the mask wearing. Your thoughts?
Yeah, I think we're going to get there. We're going to get there later than a lot of other cultures because, we're as polarized as we've ever been, and we're, as polarized as any country I'm aware of. Mm-hmm. And that gets in the way. And our both our officials and our public health officials have done a crappy job of communication. At every step. They did a crappy job of precaution advocacy early on. They did a crappy job of crisis communication in places where it was bad, and they're doing a crappy job of crisis communication now in places where it is bad. They're doing a crappy job of outrage management when people are saying, "How dare you destroy my economy?" or how dare you manage this pandemic so badly. It's stunning to me that the CDC has yet to apologize for having messed up testing. It's stunning that the public health profession has yet to apologize for having messed up masks. So we're doing a crap, you got 3 paradigms: precaution advocacy, crisis communication, outrage management. We're 0 for 3 in doing any of them well. And none, so we're going to be one of the last ones to figure out how to do it. But, we'll figure out how to do it. I have very little doubt that, we will be, if we don't get a good vaccine, a year from now, we will be dancing with the virus. and we'll be doing the things that make sense, and we'll pretty much all be on the same page. There will always be the 5% of the population that won't go along, but we can live without that 5%. We're going to get there. We're just going to be one of the last ones to get there because we've done everything badly.
Well, that was a perfect summary, and we're going to end right there. Dr. Peter Sandman, thank you so much for your time today. Please, if you could, where would people go to read about this wonderful work that you've done and find awesome articles on this topic?
Well, my website is www.psandman.com. That's PSANDMAN.com. And when you get there, you'll find it's divided into 4 main categories: crisis communication, precaution advocacy, outrage management, and infectious diseases, which overlays the other 3, but has become a special interest of mine. If you're particularly interested in COVID-19, there is a COVID-19 section of the infectious diseases index, which now at the moment has 23 items in it. And it's growing.
Fantastic. Well, Dr. Peter Sandman will direct people to psandman.com. Thank you so much for your time today. Thank you for your work in the world. It's valuable and really necessary and needed. So thank you.
Thank you.